Hi, my name is Beverly Fugler, and I am presenting A.V. Cohen, a 31-year-old male who's here for evaluation for cough and fever. About a month ago, his symptoms started. He describes it as cold symptoms with a runny nose and feeling tired and weak. He also started with a cough about a month ago. He noticed that he had a fever a week ago and that in the past 2 to 3 days, his cough and symptoms have gotten worse. He has a non-productive cough. It keeps him from sleeping. He also experiences shortness of breath with his coughing and exertion. He's tired and weak. He has not been able to work in the last 2 weeks because of the tired and weakness. He tried paracetamol and tea, and that helped him initially, but now he is getting worse, and those things are no longer helping. His past medical history, he has no medical, surgical, or psychiatric history. His immunizations are all up to date. He did have STD screening a year ago. He has no medication allergies, no food allergies, no environmental allergies. He takes paracetamol orally over the counter as needed for headaches. He takes no other over-the-counter medications, no herbal remedies, and has no prescription medications. His family history that he provided, his mother died 3 months ago of breast cancer, denied any other medical history for her. Father is alive and healthy. He does not know of any medical history for him, and he does not know of any medical history for any of his other family members. Socially, he drinks beer 3 to 4 nights a week, about 2.5 pints, sometimes more on the weekends. Did marijuana in high school, but quit. No other drugs. Heroin injection for the first time a few months ago while he was in Romania. Has never done that before or since then. He is a 1 pack per day smoker since he was 21, but he quit recently a few weeks ago. He doesn't exercise regularly, but he does walk at work. His review of systems revealed that he has positive recent weight loss. He also is experiencing night sweats. He traveled to Romania a few months ago. He denies lymph node enlargement, nasal congestion, and pain. He denies hemoptysis. He denies chest pain, but he does have an unusual feeling in his chest that he describes as an inability to catch his breath. Denies swelling or edema to his extremities, denies orthopnea or nocturnal dyspnea, and denies palpitations. He does have a decrease in appetite, but denies abdominal pain and denies nausea, vomiting, and diarrhea. He does express weakness to all 4 extremities. Physical examination, vital signs, height 5'9", weight of 148 pounds. Blood pressure was taken supine and standing. Supine it was 119/79. Standing it was 115/75. He does not appear to be orthostatic. His heart rate was 96. His respiratory rate was 26. His oxygen saturation was 91%, and his temp was 38 degrees Celsius. He is alert and oriented ×4, does appear to be relaxed, is mildly ill appearing, does appear to be short of breath, and diaphoretic. Skin is pink, warm, moist. Color is consistent with ethnicity, and he has no scars or lesions. His head is normocephalic, atraumatic. His eyes, sclera white, conjunctiva clear bilaterally. Pupils equal round and reactive to light and accommodation. He has no discharge. Tympanic membrane was pearly gray, visible cone of light, clear ear canals. Nasal mucosa is pink and moist. There is a small amount of clear discharge. Septum is midline. Terminites are pink and moist. Gums are pale red, moist. Mucosa is moist and pink. His pharynx does not show any erythema. Tonsils are present, not swollen, and do not have any exudate. His throat is supple. He does not have any palpable lymph nodes and does not have any pain or tenderness upon palpation. His lungs show symmetric respiratory movement, no retractions, no accessory motion. He does have a regular rate at 22. Lung sounds are clear, symmetric, and vesicular. He does not have any adventitious lung sounds. Percussion notes were resonant, relatively loud, low pitched, and long in duration. His cardiovascular heart rate rhythm was regular. He has no murmurs. He has S1 and S2 present, but no S3 or S4. His carotids were +2. He has no bruits bilaterally. He's got no extremity swelling or edema, and his cap refill was less than 2. Abdominal exam was, his abdominal abdomen is symmetrical. He has no tenderness with light or deep palpation, no hepato or splenomegaly, no referred pain or rebound tenderness. Musculoskeletal showed a 5 out of 5 strength in all 4 extremities. So based on his history and his presenting illness, the differential diagnoses that I went with were HIV, COVID-19, and lung cancer. A chest x-ray was performed. It showed bilateral infiltrates consistent with pneumonia, specifically PCP or pneumocystis jirovecii. This particular type of pneumonia is caused by a fungus and is known to happen in immunocompromised patients. So a secondary test, the ELISA, was performed, and the HIV-1 virus was detected. A CBC was also performed, a hemoglobin of 11.2, a hematocrit of 42, platelets were 140,000. All of those are below normal, and the bands were 5%, which is elevated. Sputum cultures and blood cultures were also done, which were negative. Based on these findings and his vital signs and the way that he presented, I chose to do an inpatient admission to start his treatment. The recommendation for treatment for PCP is Bactrim, unless allergic. He has no allergies. The dose is 320 milligrams, 1600 milligrams, TID, intravenously. And then he's also recommended to get 100 milligrams of PO dapsone daily, and then prednisone 40 milligrams PO BID. I recommended oxygen to maintain his oxygen sat to greater than 92%, and normal saline at 125 milliliters an hour for hydration. It is also recommended that he receive art therapy within 2 weeks of his treatment. He is going to need a large amount of education on his treatment, on the treatment for his pneumonia, on his diagnosis of HIV, on his future treatment for HIV, and then he needs to follow up after he is discharged from the hospital. With this process, there have been a lot of learning. One, I did not include pneumonia in my differential diagnosis. That should have been number one, based on his history of coughing and all. Now has a fever and his SATs are low and shortness of breath. I went with HIV because of the symptoms and because he had recently injected drugs, but I left pneumonia out. I also noticed that I did a lot of inadvertent physical exams because I was having trouble with the actual program. Also did not do did too many diagnostic exams because I was having trouble figuring out which ones to use. So did multiple sputum cultures because I was not aware of which one that should be utilizing, but also did not do some of the diagnostic examinations that are recommended by the research when it comes to this pneumonia and HIV, including a CD4 and a CD8 count, which will guide his treatment for his HIV. It's definitely a learning process with having to figure out the machine and asking the right questions. There are lots of questions that will lead you astray, and I found that some of them are repetitive and unnecessary. And then, there are some things that I did not perform that I should have, including a complete cardiovascular exam. I did not do an EKG, which should have been recommended based on his complaints of really funny feeling in his chest and, the things that were, going on there. Thank you for your time. Have a nice day.